welcome back to another episode of Palm Coast Acupuncture and Chiropractic,
the podcast. Today we're talking about chronic shoulder pain, the causes, and what you can do to help treat it.
So let's talk a little bit about some structure and some anatomy first. So a couple of the basic issues when we talk about shoulder pain. First off, shoulder is the most unstable joint in the body. It's one of my most favorite joints. I used to have some shoulder issues. To those who know me, that's actually why I do the chiropractic work that I do, working a lot with muscles and structures and functions and all that kind of fun stuff outside of the spine. So you have to first off know the big why. Then you have to know where, and then you got to know how. And that's where basically we all come into play. So the first off, the shoulder, okay? So shoulder is the most unstable joint in the body, which means that it has the most mobility, okay? If it has a lot of stability, then it doesn't move a whole lot. So this thing, very unstable, requires basically four muscles called the sits muscles that hold the whole thing together. And they are the most commonly torn muscles, or hopefully in your case, sprained or strained, that cause shoulder pain, okay? So I want to talk about the bicep tendon, one of the most overlooked muscles. Right here in the front of the body is the bicep muscle, but bicep means two heads, bi, two, sep, head. First one goes right up into the front of the shoulder. Second one comes up to the side of the shoulder right here. It actually goes over the top and then goes deep inside the shoulder joint there. And well, that's where your slap tears and those kinds of things that can develop if you have a nasty slip or a fall or a foosh type of injury, fall on an outstretched hand. We don't really like those too much. Structural issues. The next one's the rotator cuff muscles, mainly the ones right here in the back, come right around. And guess what? When you have pains with these types of muscles, you get a lot of pains that kind of wrap around and then go down the arm as well too. So the vague types of pains that go down the arm, a lot of times these rotator cuffs, if you press right there, yeah, it's really pretty sharp there. So once when you kind of know the why these things are going on, then it dictates the type of care that you would do. And then, hey, that's where we come into play. So hardware, software. So, if you're looking at the muscle issues, well then, hi, this is what I will do. You can do some Graston work. We can do some K-taping. We can do some laser, shockwave, all these types of things to kind of help grow and knit the tissue back together again, getting rid of myofascial adhesions, getting proper mobility back, function back. And then after all of that kind of fun stuff,
then the software comes in. And that's decreasing the inflammation, increasing the circulation to help the body heal, to help that area heal.
Also, hey, talk about trigger point injections.
Oh, so we have something in the office. It's acupoint injection therapy with Serapin. So Serapin is a non-steroidal herbal injection that you can use in place of steroids. Really great for pain relief. So it's great for tendonitis, bursitis, any kind of itis that you have going on.
The itis.
If you got the itis, the Serapin would be good for you. We've had some really great results with it so far.
Oh, yeah.
I'm quite happy with, we have a patient who is currently post-recovery hip surgery, and it's really helped him quite a bit. So, just to be able to function, he's 5 weeks post-op now, and you wouldn't even know he just had a total hip replacement. I know we're talking about the shoulder, but yeah.
Just one example, he's probably a most recent example of that case there.
Mm-hmm. But acupuncture and chiropractic together, we can do a lot for sprain strains. The only thing, if you have a muscle tear, which sometimes people don't respond well to care.
Minor tears, though.
Minor tears can heal, but if you have a big tear, that's something that we can diagnose together, and that we would send you to the appropriate place to get the appropriate care. Sometimes surgery is recommended, sometimes it's not. Sometimes it's PT, sometimes it's not. Well,
that's going back to that whole why thing that we were talking about there. If it's a small tear, sometimes longitudinal or even lateral, depending on which of the fibers go, if those are torn in just the right way or wrong way, as you like to say, yes, we can rehab those. If it's a full avulsion type of tear, I'm sorry, surgery is your only option on that one. We don't have the magic pills for something like that. But it always goes back to a case-by-case basis. Everybody is kind of unique. Everybody's kind of special. You have to really look at these things really on a case-by-case thing. But one of those situations of a tear versus a sprain strain would be like if you can raise your arm up all the way, probably not torn, probably a sprain strain. If you get to a certain point and then like the shoulder just starts hiking up like this and it just really flipping hurts, you might have a tear. But again, you got to go to a trained professional,
Hi.
that would be us, to kind of diagnose or differential diagnose these types of things. You might need some additional imaging. We have x-rays here in the office, but soft tissue tears, sorry, MRI, you need one of those things. Or diagnostic ultrasound, those also work too. Not as common these days, but MRI would be the gold standard for that kind of thing.
But we have the ability to send you for those type of tests should they be needed.
One-stop shop,
Yep.
like I said, these are the things that we love to treat here. We have lots of these types of cases.
But I think what sets us apart from other places is that it's the differential diagnosis. Everybody is different. It's not a cookie cutter place here.
Absolutely.
We spend time with people, we get to know them, we figure out what's wrong with them, and then if we can't help you, we'll get you to the appropriate place that can.
You know what? That's actually a really good. We should do that one maybe for another video. Actually about the
Differential diagnosis?
the differential diagnosis. Yeah.
Everybody's unique, man.
Well, yeah. I mean, special snowflakes, right? Not in Florida. Anywho, if any of this stuff sounds like you, please consider us. We are your family practices. 386-225-6134.
Or visit us online at palmcoastacupuncture.com.
Take care, guys. Hope you have a great day. Bye.